begin by saying how I agree with something Mr. Stark said at the beginning of this hearing. He said that this debate is a profound one and that this vote may possibly be the most important vote we take in our service here in Congress. I agree. It's a big issue. It's a big debate. I have a number of regrets. Let me list a few. The bill we got less than 48 hours ago. The chairman's mark, the amendment of the substitute, we got at 3 minutes to midnight last night. I regret the fact that not a single person who's about to vote on this bill today has read this bill. I also regret the fact that the Congressional Budget Office has just told us they don't know what it costs. So we're about to vote on a bill that we haven't read, and we have no idea what it costs. And what's also been quite amazing in this debate, as this year has proceeded, is the rhetoric has been so sweet. The words work really well. The things that are said about this bill sound so good. But I don't think I've ever seen an issue where the rhetoric so clearly contradicts the substance of this legislation. No one under $250,000 of income will get taxed at all. There's a bunch of taxes in here that taxes everybody. If you like what you want, if you like the insurance you have, you can keep it. Well, that's what this amendment is all about. This amendment is very simple. It strikes the public plan. It says no government-run plan. Now, I enjoyed the questioning by Mr. Van Hollen and Ms. Schwartz of CBO, and I wish they were still here. Let me explain why it's a stacked deck. Let me explain why the public plan is really a case where they are the player and the referee in the same game. Let me explain why it's really virtually impossible for a public plan to compete fairly on a level playing field with the private insurance market. 4 big advantages the public plan has. Number 1, public plan doesn't have to pay taxes. The privates do. Number 2, the public plan doesn't have to have large capital reserves. The privates do. Number 3, the public plan does not have to account for its payroll and benefit costs of its employees. The private sector does. Number 4, the public plan gets to dictate the prices it will pay for services, and so clearly the private plans do not. Now, there's a debate about actuarial firms, what they say, what CBO says. Let me just tell you what a couple of actuarial firms who are reputed, often cited by both sides of the aisle, who do it for a living. One group tells us in 3 years, 122 million people will get pushed off of their private health insurance. 2 out of every 3 Americans will lose what they have and get pushed onto the public plan because of all of these factors, because of the cost shifting that occurs. CBO doesn't think cost shifting is that big of a deal. They don't think it really occurs. If we're underpaying hospitals by 30% with Medicare and underpaying doctors by 20% of Medicare, where are they going to make up that difference? You know, studies show that a combined family of 4 will have higher premiums of $3,628 right now because of Medicare and Medicaid underpayment. And so we're going to exacerbate that underpayment. Let me read a quick line from an editorial today in Investors Business Daily. I think it pretty much gets this right well. The public option won't be an option for many, but rather a mandate for buying government care. A free people should be outraged at this advance of soft tyranny. Pretty harsh words. These are words that I think are appropriate for this moment. Why don't we say, let's make private health insurance work? Why don't we work together to make it affordable for everybody? Why don't we pass legislation to address the problems we have? People that don't have health insurance, people that have pre-existing conditions who can't get it, and the fact that its costs are rising so much. We could do that together if our agenda was not to have a government takeover of health care. With the public plan, no matter what actuarial model you look at, it goes in that direction, and in this debate, direction is destiny. And the destination of this bill is to have the public plan crowd out the private sector. I am looking forward to a vibrant debate on this point, but I urge my colleagues to think twice about this moment. Think twice about the moment when you're going to vote for this bill, and think about what your constituents are going to say to you in 3 or 4 years when they have lost the health insurance that they have. 80% of Americans like what they've got already. Let's address those Americans who don't like what they've got and not take these things away from those who like what they have. I yield.